So we are now going to have poster presentations. Everyone gets 1 minute to say something about why you should go and look at their poster. All the posters are on view, so you can look at them over the next couple of days. There is a competition for the best poster, so you'll need to be thinking when you look at them, which one do I want to give the prize to? There'll be a process for the competition as well. Right, so what we're going to do is everyone gets 1 minute, and then at the end of 1 minute, we all start clapping whether or not they've finished speaking. It's so funny.
Hi, everyone. My name is Andy. The poster I'm presenting here is a collaboration between University of Michigan and University of Ghana, funded by the Bill and Melinda Gates Foundation. And we're using data from the Ghana Demographic and Health Survey and also a Living Standards Survey to examine the association of livestock ownership and anemia. Livestock ownership is not associated with anemia amongst women of reproductive age, but it is associated with an increased risk of anemia amongst young children. And if we disaggregate that, we see that poultry ownership is driving that association. We also see that household consumption of animal source foods, particularly eggs, is associated with livestock, but it's not associated with consumption amongst children. So we hypothesize that this increased risk of anemia amongst children might be driven by infection, particularly subclinical infection, because we adjust for things like malaria and other confounders. So come by the poster, I'll tell you some more about it.
My name is Thorn, Lyman. In our study, which was funded through the Nutrition Innovation Lab, this was nested longitudinal study in the context of a randomized trial by Heifer International in Banki, Nepal. We examined the association at 3 points in time. We measured dietary diversity as well as animal source food consumption, and we looked at the relationship between consumption over time of children 6 to 20 months old at baseline. We looked at their development later on. So we used the Ages and Stages questionnaire, which is a 30-item tool to examine different aspects of child development. And what we found was that before adjusting for potential confounders, we found quite an impressive odds ratio for both animal source food consumption and dietary diversity, and in the risk of being in the bottom quintile of total development.
So our paper here describes the food restriction practices during pregnancy and lactation in Banki. It also looks at the most commonly restricted foods and factors affecting the restrictions. Food restriction was defined as avoidance of 2 or more foods for reasons other than simple dislike. We found a third of the women had food restriction during pregnancy and lactation. The commonly restricted foods also included nutrition-dense foods. Food restriction was found to be associated with wealth quintile, education, and caste. In conclusion, the paper makes a point that in addition to nutrition and agricultural interventions, there should also be focus on tackling food taboos to ensure that women do in fact consume nutritious food available to them. Thank you.
I'm Ashley Akeson, Social and Behavior Change Advisor with the SPRING Project. We're funded by USAID to reduce stunting and maternal and child anemia. SPRING is partnering on the Upscaling Participatory and Video Approaches for Nutrition, or UPAVAN project, which aims to improve nutrition outcomes in Odisha, India. UPAVAN is using participatory research to include community voices in the design of nutrition and agriculture interventions which use community video and PLA approaches. And on this pitch slide are some illustrative quotes from participants in that research. Partners have used our research findings along with evidence-based criteria to agree on a priority package of nutrition and nutrition-sensitive agriculture practices to promote. Promoting a limited number of priority agriculture and nutrition practices is more likely to lead to sustained behavior change at individual, farm and household, and community levels.
My name is Barbara Kramer. I'm a research fellow with IFPRI in Washington, D.C. This poster describes a study with dairy farmers in Kenya who every day when selling their milk choose between a cooperative, which pays once a month, or buyers in the local market, which pay cash the same day. And in fact, farmers are sacrificing 20% of their dairy income by selling in the local market. So this study is looking at why are farmers selling in the market despite lower prices. And what we find is that sometimes farmers just need cash the same day, for instance, to pay for their medical bills. This cash management function of the local market should not be ignored when we are talking about initiatives to strengthen value chains for nutrition. Thank you.
Hello, I'm Biraj from Bihar, India, and we work with the SHG Forum self-help groups. And as you know, Bihar is actually, the nutrition status of Bihar is very poor. Almost every second child is stunted and every fifth child is wasted. And we work with a community where actually the diversity is absolutely poor. Almost Bihar, less than 10% children get adequate diet. So when we work with these women, we actually promote dietary diversity, and it's very interesting to see that when we work with the SHG women where the nutrition layering is happening, the minimum dietary diversity has increased. Though if you look at the data set, it talks about the egg and the flesh food is not increasing, the consumption of flesh food and egg is not very good. But if you actually layer in the nutrition messaging and continuously work with the various linkages, we see there will be a great change. And I invite you to look at the poster in the ground floor, number 9. Thank you.
I'm Christine Lamanna from the World Agroforestry Center in Nairobi, Kenya. So how many people in the room collect or use data on nutrition? Hands. Everybody, right? So, but you know it can be time-consuming, expensive, and difficult to collect the data. So we partnered with the World Food Programme's MVAM team to test whether we can actually monitor nutrition data through mobile phones in rural Kenya. And we wanted to know, can we collect this data? And if we do, does it actually change the data, the inferences, and the estimates of nutrition that we get if we collect it through mobile phones? And the teaser is, well, it depends on what kind of data you're collecting. So I invite you to come and visit us downstairs in the lobby. If you collect nutrition data, are interested in ICTs for data collection, come on down and we're happy to talk about it.
My name is Corey O'Hara. I'm at Tufts University. My research is on market-based agricultural interventions and their link to diets, understanding dietary change as a result of agricultural intervention. A first step in this research requires understanding what diets look like. So I took some basic data that had already been collected on the Household Dietary Diversity Score. I pulled it apart. I recombined it using looking at the correlation between different food groups within this indicator, and what I discovered was there were several diets that were actually fairly stable over time in far west Nepal, one of which was actually highly relevant in terms of child anthropometric indicators. So it was, long story short, there are some very interesting implications about this. I'd love to talk with you more about it during the poster session downstairs in the lobby. Thank you.
My name is Darlena. I'm with the London School. I'm a PhD student. So I looked at the horticulture's effect on affordability, availability of fruits and vegetables in Kerala. What we find is that the discourse matters. What you believe sometimes affect what you see on the ground. In this case, we found that the discourse was about livelihood and dignity for farmers. It was about income, which sort of started changing to more about well-being of the environment, well-being of yourself. And further ahead, it started changing towards food sovereignty. But what did we find? We find that there's a feminization of agriculture. We also found that the people who really gained in all of this were the traders. The traders gained, consumers didn't really gain. Fruits and vegetables became a luxury that few could afford. And plus, there were unintended consequences of pesticides.
I'm Delia Grace from the International Livestock Research Institute in Nairobi, Kenya. What is not measured is likely not to be very well managed. And I'm one of the academy groups who are working on metrics, speaking on behalf of the group on food safety metrics. So what we found is that there is no real consensus set of food safety metrics or indicators, partly because it's only emerging. Just recently we've realized that the burden of foodborne disease is comparable to that of malaria, HIV, AIDS, or TB, so it has been greatly underestimated. But the good news is that there is a set of metrics from different disciplines. Food safety really is an interface discipline where agriculture, economics, health come together, and that by drawing on indicators and metrics from these different disciplines, we can come up with a better way to measure and to manage food safety in poor countries. Thank you.
I'm Deepak. This poster is about dietary diversity and anemia during pregnancy. Anemia during pregnancy is a significant public health problem in Nepal. Diets of pregnant women in Nepal lack diversity and low consumption of animal source food and vegetables. The aims of this study was to explore association between dietary diversity and anemia during pregnancy. We conducted facility-based cross-sectional comparative study in a central hospital of Kathmandu. We included 199 anemic and 198 non-anemic pregnant women in the study. As a key result, consumption of green leafy vegetable, pulse, fruits were higher among non-anemic as compared to anemic. Low dietary diversity was more among anemic as compared to non-anemic. Please visit our poster number 15.
My name is Doria Majirian. I'm a PhD candidate at Wageningen University in the Netherlands. And I'm part of a bigger multi-country project on adolescent nutrition in developing countries, Nepal, Ghana, Mexico, and the Philippines. And as part of this project and my PhD, we did a systematic narrative review on the associations between adolescent undernutrition and social, economic, and cultural aspects in low-middle income countries. So despite growing attention in adolescent undernutrition, a comprehensive picture is on determinants and consequences of undernutrition is quite limited. So I listed the main results on the left side. If you want to know more about the review or our project 10 to 20, visit poster number 16. It's in the lobby downstairs. I'm happy to meet you, and you get free Dutch cookies. So yes.
I'm Faria. I work for the USAID Agricultural Extension Support Activity Project of CARE Bangladesh. The project strengthens the existing extension system of central and southwest Bangladesh to sustainably improve the food security and nutrition of smallholder farmers with an emphasis on women. The project links farmers with public extension system representing crop, livestock, and aquaculture, and also link the farmers with, also support the farmers with technical training, ICT support, financial support, and also with market linkages. The project observed that with a comprehensive program designing and as well as with support, awareness building support on nutrition practice and hygiene behavior, the farmers tends to change their overall pattern of their livelihoods in a significant and sustainable way. Thank you.
I'm Hussein Mohammed, one of Imana Fellow. We all know that there is some relationship between mental development and nutrition, but tools to assess this has become very, very scarce, especially in adolescents. So my main aim was to develop or adapt a tool that has been developed in an advanced country to be used in low and middle income country. And the tool had to be adapted both in the language and then in context, in terms of the traditional area that we are dealing with. And after adapting the tool, we tested the tool, and then we saw that there's a little variation with the tool, so we modified it a little bit, and then retested it again. And after that, the second aim was also to look at a macronutrient project that was done, how the project worked. So we tested these children when they were adolescents, and then we saw that there was no significant difference between them.
Hi, my name is Isabel Mazzorera. I'm a doctoral student at Harvard University. The project I'm presenting today is called ATENU, which is a cluster randomized intervention study. The purpose of this study was to look at whether women's dietary diversity could be influenced by women's empowerment. Basically, I came up with 3 very simple indicators. One, which is just women's participation in key activities, as well as women's overall empowerment score, as well as the variation in women's empowerment. What I found when I compared with the minimum diet diversity is that women's empowerment does influence diet diversity. Secondly, I also found that the variation in women's empowerment scores might be more important. So when we're programming in nutrition programs, in addition to just thinking about the number of activities that women are participating in and the key activities they're participating in, we also need to see whether there's variation in key agriculture interventions. I invite you to come and learn more about this.
I'm Ashish Pokhrel from the AFLACORD study. So this is a longitudinal study that is taking place in Banque. So it examines the relationship between exposure to aflatoxins and birth outcomes and stunting in infants. So we are looking at 1,675 women and infant diet. It's a period of around like 18 to 24 months. We are looking at them, and we are collecting various information like survey and anthropometrics. So in case you want to know more about the study, do visit me at the presentation, the posters. So since this is a competition, I'm going to ask you all to vote for my poster, poster number 25. And I'm appealing to my core demographics, नेपालीहरु सबैजनालाई है आएर बुझिदिनु होला हैन अनि सबै सिनियर सबै साथीहरुलाई अब यो भोट मागिरहेको छु पोस्टर नम्बर 25 है सम्झिनु होला.
My name is Kafui Ajayegbonya, and I'm presenting on agricultural policies and child undernutrition in low and middle income countries. And this is a work in progress for my Lamanna fellowship. And for this study, I'm combining data from the World Bank and other sources with demographic and health surveys from over 20 countries across over 20 years in order to examine whether changes in the ways governments intervene to distort agricultural prices are associated with changes in child nutritional status, and whether this might differ for different types of households, as well as whether other policy measures and household and individual factors are associated with child undernutrition. So if you would like to learn more about my preliminary results and methods, as well as to give feedback, you can come and visit my poster, which is down the hall. Thank you.
I'm Lori Miller. I'm from the Friedman School, and I want to know what you think. Is it possible for a community intervention focused on livestock development and women's empowerment to change food allocation practices for children in the household? What do you think? Yes? No? What if I told you there wasn't a single component about nutrition in that intervention? Well, to find out more, you're going to have to come to our poster. But what I'd like to tell you is that the odds of a child having consumed particular foods, if that food was available in the household, increased dramatically depending on how long the household participated in the nutrition. And this was true for the food groups shown here: oil, dal, fruits and vegetables, carrots, and vitamin A-rich foods, and meats. To learn more about this and what happened with girl children during the hungry season, poster.
My name is Paula, and I'm from LSHTM and you can probably all remember food scandals that there has been over the last decade, such as the mad cow disease and the melamine in milk, or that blue pork glowing in the dark that came up a few years ago. And the problem is that with food systems going increasingly complex, there is more opportunities for things going wrong. But also, consumers are more informed nowadays and more interconnected. And then this makes that food scandals can get disproportionate effects. And and some of them are totally justified, but some of them are less so, are more psychological. So what we did was into this topic, we did a literature review, finding that actually it's a very strong influencer of diet, which can ultimately impact in the dietary patterns and in nutrition.
I'm Sumanta Neopani, presenting on behalf of Poshan Community Study. So we are interested to find out what factors are associated with the household decisions to produce, not only produce, but to sell as well. So we did a logistic regression, estimated odds, and then we also did a mediation analysis, causal pathways that leads to the household decisions to sell the animal products. And we found a lot of factors, household factors associated with the production and sale, household decisions. Households being in Tarai are significant, and cost was also significant, and females' participation in decision relating to livestock was also significant. More later during poster viewing.
Told you that would be fun, hey? Right, now, that was brilliant. Thank you very much, everyone.